All right. Well, thank you everyone for taking the time and joining us today. We're here to talk about something that everyone in this space knows all too well, how hard it can be to truly engage someone who's going through a tough time. When someone gets injured, especially in the work context, their whole world changes. There's pain, uncertainty, appointments, paperwork, phone calls, reports, rehab, and the list that they're suddenly expected to do goes on. It gets long fast. And the reality is, many people start to feel overwhelmed, disengaged, and even mistrustful of the system that's trying to help them. So the question is, how do we cut through that noise? How do we actually connect with people in a way that's timely, supportive, meaningful, and not just another checkbox that's on their to-do list? And that's the problem we're trying to solve here at Perx. And that's why today's conversation is all about bringing together ideas and experience at how to engage the disengaged, especially in the context of complex long-term recovery. And to help us unpack that, I'm really excited to introduce Hadley White. And this is something he's been deeply thinking about from every angle. He's our VP of Marketing. Now, Hadley has one of those careers that crosses industries and continents. He started at Dyson in the UK, where he worked across product and marketing to set up their first in-market research function. He launched products at major international design fairs, worked in healthcare with high-risk patient populations, and has spent the last decade obsessed with how to position, message, and deliver value that actually lands with people, including some of those toughest and hardest to engage groups. At ResMed, his work led a brand new product category that went on to win a Good Design Award. And then at Propeller Health, he focused on enrolment, which is a deceptively simple word, as we know, but is a massive behavioral puzzle in itself. Now at Perx, Hadley leads our end-to-end marketing strategy, and he's bringing all that experience to bear on this one central question of how do we make it easy for people to say yes to help. So with that, I'll hand over to Hadley to get us started. Take it away.
Thanks, V. Um, and thank you all for coming today. I really appreciate you making the time on your Thursday afternoon. So today's presentation, I think I find these workshops are most useful when you have the opportunity to ask questions and you see real world examples. That's kind of what I'm focusing on today. I'll get through the presentation in about 25 minutes. If you have questions, please ask them as they come up, and Fee will pass them over to me, and I'll try and answer them in situ. And then I want to get finished with 15 minutes to spare, so we've got time for some great Q&A at the end. So with no further ado, I will get started. Yes, as Fee said, we're really focused on how to get the hardest to reach and disengage people into workers' comp programs. And I wanted to focus today on that disengaged part because there's a group of like worried well who are always easy to get into health programs or into workers' comp programs. It's the last part of people who are overwhelmed, who are difficult to get. And we get about 40% conversion rate in our return to work programs. So that's pretty good. The industry average is somewhere around about 5%. So we're doing something right. So I wanted to share with you today what we're doing and what we have learned over the last couple of years that gets us to that 40%. Fee already talked about this. Essentially, a disengaged person is just overwhelmed when they've had an injury. A lot changes at once. And so it's really hard for that person to not only adjust, but for us to kind of cut through to get them to pay attention, to enroll in programs that will help them. I wanted to do a quick, why should you listen to me section? Like, what are the enrollment rates we get? Like I said, we get about 40% across all of our return to work and personal injury programs. 70% email and SMS open rates, 10% click-through rates. We also have some programs here in America with migrant populations who are highly, highly disengaged, not injured, but a very difficult to reach cohort. We get about 23% enrollment with them. That number is lower because they won't let me use email. Have another program, which is a multiple chronic condition program. With this one, we enrolled 80% of the target population and overachieved in terms of the customer's expectations of what we would enroll by, 1.5 times. So, and there's a very simple formula that is going on behind these, and that's what I wanted to talk to you about today. But before I jump into that, I think it's really important just to level set is with what is marketing, because I'll be referencing concepts for throughout this presentation. Essentially, marketing is not hard. You've got a person who has a problem, you have a company or a product that has created a solution for those people, and marketing is the bridge in between. And so their role is to go, hey, person with the problem, over here is the solution. But more than that, I am going to build trust with you that the solution will deliver on the problem that you've got. And so it's not enough just to go, hey, there's a solution over here. The person has to trust you enough to try it because they're busy and they have very little time. And so trust is a big component of this equation. So underpinning that, I always talk about 4 parts of that marketing communication problem you have to get right. And I'll go through each of these. This is the basis of the presentation. So you've got to understand that person's problem to start with. If you don't get that right, there's no messaging, no comms, no outreach is going to make a difference if you're not addressing the right problem. The second one over is talk about the problem, but in a way that makes sense to them, using language and problem and describing the problem in a way that resonates with them. Once you figured that out and you've got the language right, you then have to reach them where they are. So you have to use channels that will access that person. Maybe it's a billboard on their way to work. Maybe it's a phone call at their office. But wherever they are, you have to reach them there. And then you have to build trust as quickly as possible. You only have a limited window in which you can get their attention and convince them to try your solution. And so the faster you can build trust, the more likely you are to be successful. And the last one is, unsurprisingly, no one really knows what they're doing. So you have to do a bunch of A/B testing and you have to iterate on your campaigns as you do them. So I want to talk about, and you have to do all 4 of these things. If one of them is broken or not working, then your campaign will be unsuccessful. So let's go through them one at a time. So understanding a person's problems correctly. I first realized how important this was when I started work at Dyson many, many years ago. So Dyson was owned and is still 100% owned by James. He owns the company and he runs the company. And so when we made products, the person we were trying to help was James, which is why we came up with these incredibly heavy vacuum cleaners because James is a 6'2" man in his late 40s at the time. So what I kind of learned, when I was working at Dyson, I looked around and went, well, this is stupid. We're not making vacuum cleaners for our target audience. And we've got to get in front of our target audience to understand their needs. We can't just keep making vacuum cleaners for James Dyson and expect to be successful. So at the time I was working on a team that was making the Dyson's first vacuum cleaner for America. So our design brief was make a vacuum cleaner that sucks the hardest, unsurprisingly. And so I convinced them to let me take prototypes of this vacuum cleaner to Chicago, to suburban households where we gave the vacuum cleaner to people and just watched. And this woman on the right had a very deep blue plush carpet. And as she was using this incredibly powerful vacuum cleaner, the vacuum cleaner is filling up with blue fluff. It is chewing up her carpet. And I'm thinking, this woman is going to be horrified. She's going to hate this product. But what she actually said was, this is amazing. I had no idea how dirty my carpets were. This vacuum cleaner is fantastic. And I tell that story because your expectations of the person's problem and their perception of your product never matches up with what they actually think when you go out and talk to them. It's really hard to get out there and talk to people, but it's incredibly crucial to be able to identify the right problem you're trying to solve. So that's a story about a vacuum cleaner. The same thing applies in workers' comp or with injured workers. They have a unique set of problems that have just come into existence because of their injury, and you need to understand them by talking to them. I know it's hard to get out there and go into someone's home and talk to them about their problems. So I always talk about this in terms of tiers through which you can understand people's problems. So the gold standard is go into the home and talk to them. If you can do that, great. Next one down from that is talk to um, these people with curiosity, but just do it over Zoom or in a focus group. So not in their home, but in this, you're still talking to the right person. If you can't do that, then talk to people who interact with them regularly. This like a care team or a case manager, or if it's a clinical population, a doctor, someone who sees lots of these people and can tell you in aggregate what their problems are. If you can't do that, next one down is I do this a lot. We recruit people who are very similar to them. So I'll do online interviews with people who have had injuries, or if it's a Medicare population who fit a set demographic criteria. So I'm recruiting people who are very similar to them. And then the last one is if you can't do that, what's really easy is just synthesizing, particularly with AI, synthesizing a lot of feedback from testimonials or reviews. Um, a real world example of that last one. So when I joined Perx, they had been selling or promoting Perks to workers' comp for a while. And so we were able to take the 400 reviews that we had of the product and online testimonials and then synthesize that to find out what problems Perks was solving for them that we could talk to. I usually work in the space of 2 and 3. Do a lot of online interviews and a lot of online recruitment of people so I can have a chat to them. Cool. So you've established the problem and you know what the issue is for your injured workers. Second one is make sure the language you're using talks about their problem in a way that makes sense to them. For this one, I've chosen an example from that migrant worker population I talked about earlier because I just love this one. This group of people are very poor. They often work multiple shifts. And so when we were promoting a Perx Health program to them, it made sense to talk about money. Sorry. If you don't know, the basis of Perx Health is we motivate you to stick to your care plan by rewarding you for the right behavior. So if your care plan is do your physio every single day or go to your therapy appointment regularly, when you do that, Perks rewards you. And one of the ways we reward you is with money. So it was pretty clear that this poor migrant population would respond to money, but we interviewed the factory staff that they work with, and what they told us was they're really motivated by helping their family. So yes, they want a bit of extra cash, but they want a bit of extra cash in the service of treating their children or taking their wife out for dinner, or if we're talking about them being healthier, it's being healthier in the service of spending more time with their family. So this population had a lot of back injuries. We were able to talk about how they can improve their pain to spend better time with their kids. So figure out what the problem is, but then talk about it in a way that makes sense to that group of people. I also threw in this example. This is from Propeller Health, which is a company I previously worked at. It was a tech company. So when I joined, because tech bros love talking about how clever their technology is, all of the messaging was around the what. So it has snap-on sensors. It has a smartphone app. But what people want to hear is, well, what's the value to me? How does it fix my problem? So we literally just didn't change anything except the words from what to the why. So it's not a snap-on sensor, it's you won't forget a dose. This is an asthma population who are really worried about, are their kids taking their asthma on time? They're worried about what's the air pollution like? Can I leave the home today? So rather than it's a smartphone app, will tell you whether it's safe to leave the house. So this second point is having figured out what the problem is, figure out how to talk to people about their problem in a way that makes sense to them. Sweet. Third one. All right. You got the problem. You know how to talk to them. You have to get them where they are and build trust as quickly as possible. So there's a fair bit here. I always talk to my poor team about we're running a political campaign. You say the same thing over and over and over and over again until it goes in, and you do it through as many channels as you possibly can, and you only stop when they're so annoyed they unsubscribe. So it's a political campaign. You have a very simple message that you say over and over again through channels that will reach that person. So I break that down into multi-channel, multi-touch campaigns, leveraging existing relationships, and having the ability to vary your message. And I'll dive into each of those. So multi-channel, multi-touch. I've said this a few times, you've got to reach them where they are. So with our injured workers, we use a lot of email and SMS. That's where they are. Compared to like an American Medicaid population who are, say, much poorer and maybe don't use email, the injured worker population do have a high email usage. And so that's where they are. They have been at work. They're used to using email a lot. That's their kind of primary communication method. SMS is effective for pretty much everyone. It's the most critical way of reaching people. But for other programs, we do a lot of direct mail because some of our other populations don't have access to email, or the companies we're working with don't have email addresses for everyone. So we might use postcards. If there's a clinic involved, there's brochures or in the clinics, or there might be recommendations from the doctor. So find them where they are to get your message across. I'll talk about this one a lot. Having done that, you need to reach them in a way that builds trust. So these injured workers are in this state of, this company, Perx Health, has come along and said, I can fix your problem. And they're going, well, I don't know you from Adam. Like, why would I use your product? And you need to get them to a state of, okay, cool. I know who Perx Health is now. I believe them and I trust them. I'm going to use your thing. I'm going to try your thing. So if you want to enroll them in your program, you have to build trust very quickly. So I've got some tricks to doing that. The first one is you need to be introduced by someone that they already know. This is a really good way to fast track building trust. It's like a cheat. So in our workers' comp programs or personal injury programs, there's a couple of ways we do that. The name of the organization they already know, so like a WorkSafe Victoria or a Return to Work South Australia, or an organization they already know, piggyback off that. If there's a caseworker involved or a physio that they know, leverage that, use that person to introduce your brand. We don't do this as much in the personal injury programs, but in some of the clinical programs we run, we send a letter that I have written, that my team has written, but it's branded as if it's from the insurance company, introducing us before they get an email campaign from us. Or maybe the first email they receive looks like it's come from the insurance company or from the company they already know. So that's a really pivotal way of getting them to pay attention quickly. Examples of how we do that. So the text message on the left there is a pretty standard first message that we send for our injured workers programs. So it'll be, your WorkSafe case manager has created a Perx account. Click here to download. That's an incredibly effective message. If I can personalize it even more and put the case manager's name in there, brilliant. Don't often get that level of detail, but you want to leverage an existing relationship. On the right, an example of how that made a massive difference. So we tend to do these focused 6-week campaigns to get people enrolled into workers' comp programs. And then we have a break to give people a chance to just give them a break. And then at about week 10, we kick off again with a re-engagement campaign. So the first campaign tends to get all the highly engaged people, and then the tail end of that cleans up a few people. then you come back fresh with a different message to try and get the people who have just not been listening. In that second campaign, we just sent a cold re-engagement email, had a 34% open rate. We then preceded that by sending an SMS from the customer introducing Perx, and that same email had a 44% open rate. So that introduction does make a big difference. Obviously, we have a contract with QBE. This is leveraging, trusting a relationship to the next level. QBE have agreed to let us use their brand language in our emails. So this is my ideal. I try to mash up the Perx Health brand language with the customer brand language. So this is QBE's color palette, their photography type, combined with Perx's app images, our stylistic devices, but basically trying to make them look like QBE healthcare emails that they're used to receiving about their injury. So you can have an introduction letter from the insurer or from a caseworker, SMSs, and so on. And then this last stage, if you can co-brand in a really deep way, it can make a big difference to your enrollment rates. My notes for this slide are, if your product sucks, you're in trouble, just go work for another company. Because what's going on here is you can do all the things I've described. You can find the problems that they have and talk to them in a really specific way. But at the end of the day, everyone is motivated differently. So what I tend to do is have a core message that is really important and works, and then have variations of message around that. Sorry, to make that less abstract, these emails are actually a pretty good example. So when we look at return to work programs, some people are motivated by use Perx and look after yourself and you'll get a bit of extra money. Some people are motivated by get into your recovery routine really quickly because they're overwhelmed and they want to be able to get on top of this situation. Other people are wanting to connect with their claim. And so we talk about use the Perx Health app and you will be able to manage your claim and connect with your insurance company. So this is not a Perx pitch. I just know this product really well. Perx has the ability to have lots of different ways that we can talk about the value of the product. And that allows me to have my core message, but then write emails with different focuses. So one email will be focused on the health outcomes. Another email will be focused on connecting with your insurance company. And that versatility in the product makes my job a lot easier. Because what happens is they'll get 6 emails. One of those emails will resonate with them. The whole time I'm talking about make your recovery simple and get back on your feet faster. But within that, there's all these different emphases. Okay, last one. I'm almost on time. Last one is test and iterate. You just have to do this a lot. You have to track what works and then improve on it all the time. And everyone will be aware of doing like A/B subject line testing or changing images. That's really important. Here are some examples of what we did to get up to that 40%. So when I joined Perx, they got about a 10.5% conversion rate for their campaigns. And by conversion rate, I mean company gives us a list and 10.5% of them downloaded the app, enrolled, downloaded the app and started using it. So we got it from 10.5 to 39. And what we did was changed 1, max 2 things every quarter. So took that first email from at 10.5% and then just put new pictures at the top. So made it very visual and moved up the call to action, moved up the buttons, and that got us to 16%. Then we rewrote the copy to move to values focused messaging, like that Propeller Health example I showed. So talking about this is the benefit to you, made the pictures much bigger and made the pictures aspirational. Then from 23 to 39%, we did a whole bunch of things bit by bit. Got rid of a lot of copy, so made it much shorter. Put in a bunch more pictures and made it modular. So I basically have a picture and a short sentence and a picture and a short sentence, and each one of those modules is talking to a different value prop. And then the really big one, which I was not expecting, like I said, these workers' comps programs are usually email plus SMS. So we played around with how we use SMS. And so we had this, we were doing really, really well. And then we bumped up dramatically from about 34% to 50% conversion. And that was just SMS. So we said, why don't we just try increasing the number of SMSs we send? So we increased it from 3 to 5. We changed the SMS copy. And essentially, I had thought that what would happen is you'd get a spike of enrollment from the first SMS and then like a tail where SMS became less and less effective. Basically, every SMS converted consistently. The early ones were like 10, 15%, and the latter ones were more like 5, 7%, but it was pretty consistent. So essentially, send another SMS, get another batch of people enrolled. And that was not what I expected. And so just by testing and iterating with copy and with frequency of email and SMS, we got a really big lift. So to pull it all together, how do you enroll the disengaged into workers' comp programs? Okay, you've got to understand, you've got to take the time to understand their lives and problems. Sitting behind my computer, I cannot understand what it is like to be a person living in Perth who has been bullied at work, who is working 2 shifts and is now finding themselves unemployed and is maybe a single mother of 2 children. I cannot empathize with that person. I have to talk to them. So take the time to understand their lives and the problems that they have. Make sure your product actually fixes those solutions. I put that in there because I've worked for companies before where the product really just doesn't fix the person's problem and you are pushing the proverbial uphill all the time. So just don't work for those companies. Talk to them about the solution to their problems in a way that actually makes sense to them, and then hit them with that message as many times as you can through as many channels as you can, particularly the channels where you know they're going to be. But also, if the customer will let you use every single channel, just because they only have addresses for 50% of people doesn't mean you should not send them a postcard in the mail or a letter. Yeah, you need to build trust with them as quickly as possible. Cheat by using an existing relationship or a company or a person they already know. And then keep an eye on all of your campaigns. Do simple tests in chunks so that you can figure out what's working and what's not working. I forgot to put this in. I was having so much fun looking at old photos of me at Dyson. This is just to show that you're not young and beautiful forever. So this is me bottom right in that blue t-shirt. And then on the left there, it was a watch company. I tried to be a self-made entrepreneur and started this watch company. And that's me doing my own photo shoot. So I may sound professional today, but it wasn't always the case. And then I had to throw this video in. This is some research I did with some diabetes patients last year. And it was asking them about, what their lives are like and how Perx worked and everything else. I just love this video. You'll see why when I show it to you. Essentially, this is what happens when you do customer research in Australia.
He come in one day and says, I've been, says to Nick, his wife, and says, I've been grafting today, Nick. And he was working with me, and he done. Hey? That was just work. Where? No. Wait a minute. Tiny. Where? Hang on. It's tiny. Don't go near it. Tiny ones. Hang on. I've got to go. There's a snake. No, wait. Oh, go. Shit. Sorry out, Gavin. Lovely talking to you, mate. Is that all right? That's totally fine. No, we're good. I'll wrap up and I'll send you. Get the shovel in. Go get the shovel. Hey? See you later. I'll be in touch. I'll send you your gift card. You get that. Thanks, mate. Good on you. There's a nice snake there. Look at him. He's only a little one, but where's it? Where's the big one? I need to keep the dogs in. Nick, need you to keep the dogs in. Can you lock that? No, don't get there. Mate, you think I want to get big? I'm looking out for you. Oh, don't.
So that's what happens when you talk to real people. So thank you, everyone. Hopefully you got something out of that. I have done what I promised, which is leave 15 minutes at the ends for questions. So yes, thank you for taking the time to listen to me, and I would love to answer your questions about how to get these people enrolled.
Thanks so much, Hadley. I do love watching that video at the end. It always makes me laugh, even though I've seen it a few times. Yeah, well, thank you, everyone. Please pop in some questions if you've got anything from what Hadley's gone through today. I probably failed to do a bit of an intro before we started one on myself, so I'll give you some time to write some questions if anyone's got any. I'm the Director of Enterprise here in Australia, and please, if you've got any questions about what Hadley's talked about or just in more general around what Perx as an actual solution does, because I'm aware that some of you might not actually know so much about our product, but a lot of the things that Hadley talked about today, we actually find just as important when we're talking about building the product around what motivates, what engages people throughout their recovery journey, and how can we tap into the fact that everyone's motivated differently, and that through their journey that will change along the way. So those behavioral science and strategies that we use within app is really critical. There is one question coming through, Hads. So if you had a campaign that had under 5% enrollment, what would be the first thing that you would look at?
The first thing that I would look at, I would look for quick wins realistically. So I'd take the campaign, and it's often pretty obvious if you try and look at it through the eyes of the person you're trying to reach. So are you using pictures that look like what they're going to achieve? So you want to kind of show them the aspirational picture of this is what's going to happen, or this is where you're going to be if you use the product. Does the language speak to the way that your solution is going to fix their problem? I would do that basic stuff. It's surprising how simple it is to get that wrong, and make it super, super, super simple. And then show it to someone who doesn't know your product. Like, does this make sense to you? I'd then start doing more structural stuff like going away and interviewing the people that I'm trying to reach in a very open-ended way. I usually start with, just tell me what your life is like. What's going on in your day-to-day? What does a typical day look like? What's your family like? What problems do you have? What do you like to do at the weekend? Just to be genuinely curious about who they are, and then start talking about, well, what problems do you have as it relates to what I'm trying to solve? And make sure that the way they talk about it is how you're talking about it. Then often the 5% stuff often comes, in my experience, comes from you being constrained by your customer. So where possible, never give up control of your enrollment process. I know that's an aspiration, but if you are letting someone, a real example, when I worked at Perx Health, it was working with providers, so doctors in America. They recruited people in the clinics, and the care teams and the nurses are so overwhelmed, they do not care about enrolling people into your program. So you have to take back control, and then you have to convince the customer to let you use every channel available and brand it in the way that you want to, and talk about it in the way that you want to. So I would do that. Can you give me a real example? Like if you're specific, I can talk with more accuracy about what I would do.
Yeah, I think in terms of like if you've got a campaign and you're running one email campaign, and that's it, and you're getting under 5% enrollment, would you add on SMS, or would you do direct mail, or would you just iterate on that single?
I would, okay. So the easiest thing to do there is do more of the same thing. So if your customers said you can do email and you're doing one email, like I literally send 6 emails. And the way it typically is I always say you've got 6 weeks to convert this person and then give up. You're done for. And so I do Monday, Wednesday of the first week, and it's always at like 1 o'clock in the afternoon, and then do one email and SMS a week thereafter for 6 weeks. So just do
Yeah.
more of the same with variations in messaging. So there's no point sending the same picture and the same message in each email. Shake it up and try different stuff.
Yeah. And tell us a little bit around why it's important to do it over that 6 weeks. I guess, we know that there's various things going on, but like that time frame, I guess, could you
Yeah,
elaborate on what's important?
not good with the science, so I don't have a hard and fast answer. It's basically what I've learned over the years. So we all have this experience, right? There is a point at which it gets annoying. And the trick is to push as hard as you can up against that line where it's getting annoying. So in my experience, it's like 4 to 6 weeks. Other people say 7 touch points before someone is converted. So, and I think I talk to a lot of people who are afraid of annoying the person. You just err on the side of sending too much rather than too little. What always surprises me is how many people you clean up with the tail end of a very long and repetitive campaign.
Yeah.
People think of them in different personality types. Some people are like, I've just broken my leg. I want to get on top of it immediately. I'm going to action the first thing that comes through. Bunch of other people are skeptical, particularly if they're older. I don't know this company. What's their privacy like? Why would I sign up with them? I don't understand. So you have to provide multiple touch points for that person to finally decide, okay, yes, now I'll take action.
Yeah. And when they're ready to hear that based on, the thousand of other things that they're managing at that time is really
Yeah.
important.
And the nice thing about personal injury is it's a real trigger. So something has happened that gives a really good reason for them to listen to you. And so you have to capitalize on that as quickly as possible. You have to be as close to the injury as you can.
Yeah. And we definitely know from injury management, the earlier intervention gets better results. So the earlier we can engage someone into a tool that's going to support their recovery, the better.
Yeah.
Another question. So how do you segment messaging without creating chaos?
Um, the short answer is I usually do it by condition type is the easiest thing to do. So usually you'll get some kind of eligibility file, and then I work with what I'm given in that eligibility file. So if I know what condition they've got, so good example is it's super simple, whether it's a mental health injury or a physical injury. So you can just change the email images and you can change the copy to talk about the specifics of their injury. So, basic things like talking about going to therapy appointments versus talking about going to physio. For some of the programs here that I do in America, if it's an asthma program, I might talk about remembering to take your dose and figuring out what your allergens are. That's very specific to condition or injury, as opposed to talking about trying to manage like depression or so on. So yeah, condition is the easiest one to do, whatever you get in your eligibility file. And that's pretty simple with your emails because you can just ask it to drag in different images from your content management system.
Yeah. Yeah, great. And I think to round it out, I might finish with a final question. And I know you've touched on lots of different things, which I think is, I listened to it and I've learned something today, even though I know very much the ins and outs of what you do. But if you were to say what's the biggest barrier you face getting an injured worker, a Medicaid, whatever kind of population we're working with, what's that biggest barrier you face to get a member enrolled? What would it be?
It would be cut through. So it's just you all have this experience. It's like, how do you get them to just pay attention? And so the key there is novelty. It's not very easy to do in these types of programs. But where someone will let me send something in the post, in the mail, that is a great way to get cut through. So real world examples there. Perks is about, as I said, do the right thing, stick to your recovery program, and you get rewarded. So we offer, and I talk about real world rewards. You get gift cards for doing the right thing. So where I've been allowed to, I send a package in the post that contains real world rewards. Usually something small and cheap, something not too heavy, socks, chocolates, whatever it is. Um, but that has huge cut through. I do that at conferences as well. I tend to create kits to send to the hotel room of someone I want to talk to. So you've got to create cut through. And my recommendation there is SMS has great cut through because this is such a personal device. And sending something physical in the post is a really good way of getting cut through. But also, just in that category, don't look like everyone else. Like, have emails that are brightly colored or are surprising to people. Be adventurous with your subject lines. Say something that you think might be a little bit controversial. You just have to get their attention. And if you're playing it safe, it's not going to happen. So the biggest barrier is always cut through.
Yeah. Well, thank you, Hadley.
Otherwise,
Thank you very much for all that insight and intel, and thank you everyone for taking the time over lunchtime to join us. Yeah, any final words, Hads, before we finish up? I think we've been bang on time.
I'm pretty much bang on time, which I love doing. Final words. I think you can't go wrong if you keep the basics in mind. Like I talked about at the very beginning, if you take one thing from this, think about the fact there's a person with a problem, you've got a solution, and you've got to communicate with them effectively in between, and do that in a way that makes you stand out. Can't really go wrong. And look, if you have, I love specifics. So if you have a campaign that's not working, just email it across to me, or send me a description of the problem you've got. I would love to help out if I can in any way. But yes, thank you all for coming. I really appreciate it, and have a lovely day.
Thank you. Goodbye.
Bye.